like to request Roopesh sir to add a few points to how to choose a college. What are the factors to consider?
Okay, thank you. I have already, Dr. Parimal has already mentioned several things. So I'll just mention some aspects which are different from what he has already stated. So if I were to just mention about the choice of an institution, there are some institutions which I have just generally explored what kind of things to expect. So one institution is All India Institute in New Delhi, and what I would suggest is that you need to be very methodical in your approach to determining where you would like to do your post-graduation in community medicine. Because each institution, as Dr. Parimal has already mentioned, actually has certain strengths. So naturally, it means that they will emphasize certain aspects of training more than other aspects. So it depends on what you are interested in. So one way of finding out is by visiting the website of the institution, trying to look at the faculty who are there. And usually, at least good institutions will have some details regarding the focus areas of the department, the research publications, and that would give you some sense about what to expect. So AIIMS New Delhi, from my interactions with a person who was a colleague and had trained there, there is less emphasis on clinical aspects, but there is more emphasis on managerial and administrative aspects. So things like national programs, evaluation. So you have to go and evaluate a subcenter, for instance, or a PHC, those kind of things. There are several funded projects and collaborative activities with international agencies like WHO, and the faculty interest areas are listed against each faculty. So each faculty has a profile. You can just click on that and you can see that the faculty interest areas include HIV, NCDs, health policy, environmental health, adolescent health, health administration, reproductive and sexual health, and so on. So that's an easy way of getting to know what areas your faculty are primarily interested in. So the bulk of the focus will be on these areas because those are areas which the faculty are already working on. Now, I also looked at Postgraduate Institute at Chandigarh and environmental health thing where they have very good equipment, and I think for air pollution they have something which is unique. They also have some people who have trained and got PhDs in health economics. So if you're interested in health economics, that's a place to go. They also look at NCDs. They're involved in nutrition, tuberculosis, public health emergencies, health policy, operations research. So if you're interested in any of those areas, then PGI is where you should aim. MGI, that is Mahatma Gandhi Institute, Sevagram in Wardha. Their site actually does not give too much of detail, but from what you can gather, there is a focus on MCH, ICDS, social medicine. But you must also understand that Sevagram has a very unique philosophy, and you need to know that Gandhian philosophy is a must. You are expected to wear khadi, and vegetarianism is mandatory, and no kind of substance use is tolerated. So you cannot be smoking, you cannot be consuming alcohol or any kind of intoxicants. But these are things which are very clearly stated there on their site. So if you are somebody who's okay with that, then perhaps you can try that place. I trained at Vellore, and what I can say is that Vellore gives you excellent clinical exposure. The Department of Community Medicine, now I don't know the status currently, but at the time when I trained, that time we had a 125-bedded hospital, secondary level hospital. In addition, we had a lot of different things going on. We had a mobile clinic, we had tribal healthcare. You basically will be given responsibility for around 30,000 population. I mean, that may have changed now. And the primary focus of training there is to provide compassionate care in an area of need. And the emphasis is on developing the skills you need to function as sole doctor in an area of need. And you will be able to manage various outreach activities on your own. But I must caution you that the workload is heavy. Clinical workload is quite heavy. The main areas of focus are MCH, tuberculosis, HIV. They have a very good tribal health program. They also have separate clinics for diabetes, this work on leprosy. They were actually involved in leprosy work for decades before, and even now they continue to work on that. And as I already mentioned, the emphasis on service and compassionate care. St. John's Medical College at Bangalore is the fifth institution which I would like to discuss. And many of the alumni from Vellore actually are working in St. John's. They have a focus on NCDs, occupational health, disaster response, and several elements of the training at St. John's are modeled along the lines of CMC Vellore. So you may get that. And in fact, a lot of the alumni from CMC Vellore Community Medicine Department are found in various institutions across the country. And in some institutions, at least, you will find a clear stamp of the Vellore model. So that's a unique model. I don't think that you will find it elsewhere, but as a private institution, it actually does excellent work. So depending on what your interest is, you can choose. Now, I have some caveats to these. For instance, now, although I mentioned faculty research or areas of interest, this may not necessarily translate into your PG training or learning opportunities, because the PG training program may follow a fixed curriculum that is not influenced by faculty interest areas. But knowledge of faculty interest areas and projects will help determine which institution is better aligned with your own career plans. At the very least, you will benefit from better training in the faculty interest areas. Firstly, because they will be keen to share their interest, and secondly, because there will be better resources to pursue those interests than in other institutions, because the equipment and other things which they need to pursue those interests would be there. Also, you must consider the resources which are available in other departments. So in case you're considering multidisciplinary work, or you want to benefit from other institutional facilities like excellent library, intramural research funding, subscription to software. For instance, AIIMS New Delhi spends a small fortune on maintenance of various software licenses. So that is not something which will be available to all institutions. So that's something which you have to keep in mind. Now, one thing I must say is that having a good mentor is very important. Therefore, you must try to choose the institutions which offer you the best mentorship. Try to find out how guides are assigned and whether PGs can choose their guide. You must try and talk to others to find out more about the faculty and the training pattern in the shortlisted institutions. And if possible, you should try to visit the department before deciding. You need to talk to faculty within the department to get a feel for the working environment. Some departments may be very formal, while others may have a more casual and open working environment. So you need to ask yourself, what kind of personality do you have? And would you fit in any of these shortlisted departments? Ask yourself whether you'll be able to survive alone in that institution. One important thing is inquiring and actively looking for safety nets and support systems if you should need one. For instance, a lot of stress may result in some kind of mental health issue. What kind of support system do you have for that? Would you be able to get the assistance you need? And try to follow alumni to determine the typical career path which is either available to or taken by graduates of that institution. And one other thing to consider perhaps would be to check whether there's an extensive, preferably helpful, alumni network or alumni association. They can help actually open avenues for you which may not otherwise be available. So in short, what I would say is that you need to explore based on your personality, your preference for working environment, and your interest and what plans you have for your career. So if you're thinking long term, I would like to be involved in policy, administration, I would like to be working in WHO, etc., then you need to look for an institution which already has a lot of the kind of exposure available to the trainees. And if you are interested in working in primary care or secondary care as a clinician, then looking for some institution where that is a strong point would probably be useful. Similarly, depending on what your interest is, you have to try and identify institutions which offer that particular area of interest, and they have facilities to help further that interest. So you have to remember that you do your post-graduation, and most people do their post-graduation only once. And it is useful to choose after having considered multiple things. and if you make the wrong choice, it may be rather stressful for you. So I would say that you need to consider all these things, some of which I have mentioned, some of which Dr. Parimal has mentioned, before you take a call on where you want to do. A lot of the information which I have shared regarding some of the institutions I mentioned is available on their websites. You can do a similar exercise for any institution. And one way of finding out about those institutions is to talk to people who are already there. A lot of associations and networks exist. There are lots of groups, formal and informal, from where you can get ideas about what to expect in a particular institution. And I think you should explore those before you finally settle on a place. Like Dr. Parimal said, stipend, etc., is an important thing, but it may not be necessarily an important thing for everybody. I have focused on some other areas, and I hope that between the two of us, we have given you a fairly good perspective about where you may possibly do this course.